In public health, social distancing, also called physical distancing, is a set of non-pharmaceutical interventions or measures intended to prevent the spread of a contagious disease by maintaining a physical distance between people and reducing the number of times people come into close contact with each other. It usually involves keeping a certain distance from others and avoiding gathering together in large groups. By minimizing the probability that a given uninfected person will come into physical contact with an infected person, the disease transmission can be suppressed, resulting in fewer deaths. The measures may be used in combination with others, such as good respiratory hygiene, face masks and hand washing, to slow down the spread of infectious diseases and avoid overburdening healthcare systems. Particularly during a pandemic, several social distancing measures are used, including the closing of schools and workplaces, isolation, quarantine, restricting the movement of people and the cancellation of mass gatherings. Drawbacks of social distancing can include loneliness, reduced productivity and the loss of other benefits associated with human interaction. Social distancing measures are most effective when the infectious disease spreads via one or more of the following methods: droplet contact and airborne transmission. The measures are less effective when an infection is transmitted primarily via contaminated water or food or by vectors such as mosquitoes or other insects. Authorities have encouraged or mandated social distancing during the COVID-19 pandemic as it is an important method of preventing transmission of COVID-19. COVID-19 is much more likely to spread over short distances than long ones. However, it can spread over distances longer than 2 meters in enclosed, poorly ventilated places and with prolonged exposure. Although the term social distancing was not introduced until the 21st century, social distancing measures date back to at least the 5th century BC. The Bible contains one of the earliest known references to the practice in the book of Leviticus 13:46, and the leper in whom the plague is, he shall dwell alone, the camp shall his habitation be. During the plague of Justinian of 541 to 542, Emperor Justinian enforced an ineffective quarantine on the Byzantine Empire, including dumping bodies into the sea. He predominantly blamed the widespread outbreak on Jews, Samaritans, pagans, heretics, Arians, Montanists and homosexuals. In modern times, social distancing measures have been successfully implemented in several epidemics. In St. Louis, shortly after the first cases of influenza were detected in the city during the 1918 flu pandemic, authorities implemented school closures, bans on public gatherings and other social distancing interventions. The influenza fatality rates in St. Louis were much less than in Philadelphia, which had fewer cases of influenza but allowed a mass parade to continue and did not introduce social distancing until more than 2 weeks after its first cases. The World Health Organization has suggested using the term physical distancing instead of social distancing because it is physical separation which prevents transmission. People can remain socially connected by meeting outdoors at a safe distance and by meeting via technology. The American Centers for Disease Control and Prevention have described social distancing as a set of methods for reducing frequency and closeness of contact between people in order to decrease the risk of transmission of disease. During the 2009 flu pandemic, the WHO described social distancing as keeping at least an arm's length distance from others, minimizing gatherings. During the COVID-19 pandemic, the CDC defined social distancing as remaining out of congregate settings, avoiding mass gatherings, and maintaining distance from others when possible. Social distancing, combined with the use of face masks, good respiratory hygiene and hand washing, is considered the most feasible way to reduce or delay a pandemic. Several social distancing measures are used to control the spread of contagious illnesses. Research indicates that measures must be applied rigorously and immediately in order to be effective. Keeping a set physical distance from each other and avoiding hugs and gestures that involve direct physical contact reduce the risk of becoming infected during outbreaks of infectious respiratory diseases. These distances of separation, in addition to personal hygiene measures, are also recommended at places of work. Where possible, it may be recommended to work from home. The distance advised by authorities varies. During the COVID-19 pandemic, for example, the World Health Organization recommends that a distance of 1 meter. The United States adopted 6 feet. Where other methods to mitigate virus transmission, for example face masks or plastic screens, were in place, the WHO's 1 meter recommendation stems from research